Hello, everybody. I hope you're all doing well. I hope you're looking after yourself and your family because the last couple of years have been very, very rough for almost entirely everyone around the world. And I'm glad that you all invited me in this event because I specifically recall a few years back during my nursing informatics class, I asked my students to do a similar project. It wasn't that successful because there were technical issues and connection problems. But I'm glad that this is happening right now. I am just sad because this is not happening live. Probably because by the time you're seeing this video, I am deep in my sleep and snoring in my bed. So allow me to introduce myself. My name is Nico Paulo Reliora. You can call me Nico. I'm also an Isabelino. I've been working as a nurse for 15 years. My first job as a nurse way back in 2007 is an on-call reliever nurse in Mother Seton Hospital. I worked there as a nurse generalist, typically looking after medical surgical adult clients, sometimes pediatric. And then I decided to work in nursing education and work as a clinical instructor for 3 years. And during that time, I also did my master's degree in nursing. I majored in medical surgical nursing. And then, when I had a chance of working back in the hospital, I landed a position as a post as a infection control nurse. And then during that time, I also managed the Central Resource Unit, and that was in NICC Doctors Hospital. And then when I married the love of my life, I decided to relocate here in the UK. And my first job here is as an infection treatment ward, thinking that I'll become an infection control nurse here as well because I'm an advocate of infection control. But there were other opportunities that was presented to me, and I grabbed the chance to become an accident and emergency nurse in Luton and Dunstable Hospital. But that was during the pandemic, so it was very, very overwhelming and for me. So after 2 years of working as an AA nurse, I decided to go to London and feel what it's like to work there. And then I wanted to work in a more controlled environment. That's the main reason. And now I work as a charge nurse in a cardiac cath lab in Hammersmith Hospital. So I was asked to speak about hospital-based nursing careers. And while I was trying to think about the objectives for this talk, I came up with two. The first one is for me to inspire you of the many roles that you can have in the hospital. Not just bedside nursing. So our profession is quite broad, and there are many roles that you can aim for or excel on. Like me, I thought I was just going to be a ward nurse, but I was given various options as a nurse working in the hospital. Like 15 years ago, I never imagined myself working in an emergency department or in a cardiac cath lab. If you asked me like 15 years ago, I would have said no to these roles. But I want to show here that there are various options if you work in the hospital as a nurse. You can go to renal, become a dialysis nurse. You become critical care, go to intensive care unit. If you go to ophthalmology and become an eye specialist, so many options, whatever you fancy. And if you get to the point wherein you become nurses and these opportunities are laid before your eyes, so I just hope that you choose the role that will help you grow as a person and nourish yourself professionally as a nurse. And my second objective is for me to give you a better sense, a better or deeper sense of appreciation of all the nurses working in the hospital. Because sometimes it feels like it's a thankless job, but actually it's quite a rewarding experience if you take a deeper look at it. Probably you've heard nurses complaining about being short-staffed, complaining about low salaries, complaining about being burned out. but I just want you to see the upside of the profession. As I mentioned earlier, the nursing profession is growing, evolving, and expanding. And if you take a quick look in the past, it is not something that is actually recognized as a profession. It is seen as something done by a female member of a family or a nun from a religious order. But it is only up until Florence Nightingale, the founder of modern nursing, who introduced the use of scientific principles and health education to look after the sick and the dying, especially during the Crimean War when she nursed the wounded soldiers, that the profession was recognized as a whole body of knowledge. From there, development started, and we saw nursing degrees done in hospital-based trainings, and now we see nursing courses done in universities. And in the mid of 19th century, there were males accepted in the registry. There were male nurses, and now we produce a lot of male nurses as well. And there's expansion of the role of nurses outside the hospital. We've got school nurses, community health nurses, nurses who work in psychiatric hospitals, and nurses who are in the legal system, or nurses who uses data and technology, because right now data is gold. So we've got nursing informatics as well. And what else? You also have nursing in advanced roles. We've got advanced nurse practitioners, clinical nurse specialists, anesthetic nurses, and also we've got researches done yearly to bridge the gaps within the profession. And I am just very happy right now that I am part of the nursing field. I am a nurse, and if you see it nowadays, the nursing profession is one of the largest, most diverse, and well-respected profession all around the world. And I'm happy to be part of it. And the amazing thing is that when I started working here in the United Kingdom, I was able to meet nurses who were trained from other countries, nurses from India, nurses from Pakistan, nurses who were trained from Germany, China, Poland, Portugal. It's very diverse, and it sometimes surprises me to see the similarities that we do back home when they look after their patients in the clinical area. And it's just proof to me that the nursing profession is really universal and really special, and I am not surprised why our profession is in demand all around the world. And this demand actually is expected to increase over the years, substantively increase over the years, because there are advances in healthcare technologies. We've got rising expectations of people seeking care, and we've got also the reorganization of healthcare systems. And these things require people who are highly educated professionals, nurses, and doctors, and allied healthcare professionals, mainly nurses. In 2020, the World Health Organization published that the nursing workforce was 27.9 million, but the global shortfall of nurses is 5.9 million, and 89% of these are from lower and middle income countries. That includes Africa, Southeast Asia, which includes the Philippines, and the Mediterranean World Health Organization regions. If you consider the aging population of the nursing workforce, it is expected that 17% of these nurses will retire in the next 10 years, and we need to educate and train 4.7 million nurses to maintain the current workforce. But we still have shortages, and by the year 2030, we need 10.6 million nurses all over the world. So I think majority of these nurses are needed in the hospital. I cannot find much data regarding the shortages of nurses in the Philippines, but I found an online article recently, September 2022, from Rappler website, that 106,000 nurses are needed by the Department of Health, both in public and private hospitals.
The Philippines lacks around 100,000 nurses amid the migration of health workers searching for better opportunities abroad. That's according to the Department of Health Officer in Charge, Maria Rosario Vergere. But that's not all. Vergere also says the Philippines is also now having a shortage of doctors, pharmacists, medical technologists, and other health specialists. Vergere hopes the country would retain the 7,000 annual deployment cap of new hire medical professionals abroad to address the problem.
I cannot possibly put too much stress anymore on the fact that we really need nurses. And to all the students who are watching this video, I want you to study smarter and pray harder because we need you. You will soon become professional nurses. And if you think about it, the nursing profession is a profession wherein it gives you the divine privilege of helping other people. You become a man and woman for others, especially for the poor. So it's a win-win situation. You are working as a nurse, earning as a nurse, and at the same time helping others. So think about that. And there are so many paths where you can choose from if you are serious with your nursing career. Like what I emphasized earlier, you can work outside or inside the hospital. And whatever you choose, it all boils down to your own preference. If you want to go outside the hospital, then so be it. If you want to nourish yourself inside a hospital environment, then go for it. But normally, all nurses would tend to choose the hospital environment first to acquire the basic nursing skills training. And that's the route I chose first in my career personally.
Probably one of the reasons why we choose initially to work in the hospital is that if you are trained in a hospital, you work as a generalist nurse. That means you can be placed in a medical unit, a surgical unit, an intensive care unit, in pediatric or sometimes neonatal intensive care unit. So you get the taste of all the fields in nursing. And that's something to look forward to when you start your careers. And if you are in the hospital, expect that you should be working as part of a team. So you've got your doctors, your clerks, your social workers. You've got as well orderlies and people from laundry. You are working as part of the team. And this is something that I had to learn when I worked in the hospital, especially here in the UK, because I'm somebody who, if I can do it by myself, I'll do it by myself. But that's wrong. You should tap the people who are responsible for doing their specific jobs they are assigned to. For instance, if you are, let's say, encountering patients complaining about the rooms or the services in the hospital, if you are overwhelmed and cannot address their concerns, then you should escalate that to somebody who's in charge, probably the charge nurse or the head nurse. And for instance, if there are missing pens or you've got low stocks on like papers, you can tap the clerk, or there's a problem with medication, or you don't know how to like reconstitute a certain antibiotic, then you can always form the pharmacist. So it's not a one-man job to work in a hospital. You work as a team, and you should be a good team player. The responsibilities and activities of nurses in hospital is mostly staying with the patient, and when we stay, we try to assess them with their actual and potential needs, or you identify nursing problems. If the patient has pain, if the patient has unstable observations, if the patient like have concerns mentally or spiritually, physically, we try to give as much as holistic care as much as possible to our patients. And we also give them health education and try to make sure that they're safe when they are about to be discharged. And also our role extends to the significant others as well. So especially if your patient is pediatric, so you have to reassure parents or the guardians of these patients that you are handling. So if you try to think about it, our activities in the hospital usually revolves around the nursing process. It's like the backbone of nursing. So you have to assess, you have to plan, you have to do interventions, and then evaluate your interventions by reassessing your patients. So those are the things that you have to look into Since we are all working in a hospital, we are expected to work through shift. So sometimes an 8-hour shift or a 12-hour shift. When I was working in Montecito, we worked from 7 to 3, 3 to 11, 11 to 7. So it's an 8-hour shift. Similarly to NICC Doctors Hospital when I was working there as well as a night supervisor. But we had sometimes to work on a 12-hour time frame per day because sometimes there are shortages in nurses. So we had to ask the 7 to 3 people to like extend up until 8 p.m. and then the night shift to come earlier. So that's how sometimes we manage in schedule in the hospital. But if you're somebody who's like in a different area, let's say let's say me, I'm working in a cath lab. I work in a cath lab, but I start at 8 a.m. and then I finish at 6 p.m. But sometimes if I'm on call, I have to work for 24 hours. When it comes to nurse-patient ratio, it depends on whether you work in a public or private hospital back home, and it depends which part of the hospital are you working. Let's say, for instance, you work in the ward. The normal nurse-patient ratio should be 1:8 or 1:6. But it should be 1:6 to make it safe. But if you're working in, let's say, in an intensive care unit or critical care unit, it should be 1:1 or 1:2. But in public hospitals, sadly, I think there's a lot of census that you have to work it. So you have to be creative, resourceful, and you have to manage your time really well in looking after the patient. But here, I also work in a cardiac day ward here and have worked as an agency nurse. And from what I noticed, it's usually 1:6. But if we are really short, sometimes we handle 2 bays and a side room. So in total, I think 9 or 10 patient maximum. We have to look after 10 patients. But ideally, it should be like 6 to 8 only.
To put credence on to what I was saying about nurse-patient ratio, the National Institute for Health and Care Excellence, called NICE, here in the UK, published an article last 13th of May 2014 about safe staffing plans for nursing in the wards. It says there that the guideline recognizes that if each registered nurse is caring for more than 8 patients during the daytime on a regular basis, there is an increased risk of harm. That was for the National Health Service here in the UK. But what about in the Philippines? For all I know, ever since I know that the nurse-patient ratio in the wards back home should be 1:12. And the recent nurse-patient ratio I found online is a memorandum issued by the Department of Health last 2nd of April 2020. And the subject is about interim guidelines for nursing service in temporary treatment and monitoring facilities for the management of suspect, probable, and confirmed cases of coronary disease 2019 or COVID-19. In that memorandum, it states specifically that the recommended nurse-patient ratio shall not exceed 1:12, and an 8-hour shifting schedule for nurses is ideal to provide safe and quality nursing care. A 12-hour shifting may be implemented provided that the standard 40-hour work week is followed. Now, to support the 1:12 nurse-patient ratio in the Philippines, I found an article online from Inquirer.net entitled Lifeline for PH Nurses, published last 22nd of July 2022. It says on the article that majority of our nurses earn about 10,000 in most private hospitals and a bit higher in government facilities for working extended hours. Although the ideal nurse-patient ratio in the hospital is 1:12, they end up taking care of 20 or 50 in each 12-hour shift, especially during a pandemic surge. So that's the sad thing about even before the pandemic, nurses are already handling more than 12 patients per shift. And it will depend on the nurses on duty on how they will be able to fulfill their nursing activities during the entire shift. And most of the time, I think they're just going to do a functional nursing strategy. Now, when it comes to salary, the Department of Labor and Employment has reported that the average entry-level pay of nurses is 8,000 to 13,500 a month, a pittance compared to the 2020 entry-level pay in the US, which is 213,845 at current exchange rate when the article was written. And in the UK, it is 112,221. In Canada, 179,193. An article in philstar.com published last 21st of June 2022. Title is No Shortage of Nurses but Low Pay, Lack of Tenure Driving Them Abroad. It says there that while Filipinos are deployed at Saudi Arabia, nurses employed can earn a little over 27,000 and as much as 55,500 pesos. But if they are employed through a government program, they can earn a minimum salary of 53,000 every month. And then it also mentioned about a salary in Germany, which a nurse can earn, a Filipino nurse can earn 135,700.
Okay, so here are some of the common types of nursing jobs in the hospital. We start with medical surgical nurses. Medical surgical wards are the most common types of wards in the hospital. I know that because I was also a medical surgical nurse back when I was working in Mother Seton Hospital. So Our Lady of Lourdes is a medical ward, and Our Lady of Mount Carmel is a surgical ward. I don't know if they're still the same, but I remember back in 2008, 2009, I was working there. And in a medical surgical ward, typically a nurse manages a patient load of at least 7 to 8, like what I mentioned before. They create a treatment plan, administer medication, provide care, and document everything. This line of work is very demanding, very true, and can be very challenging. However, the rewards are great. As a medical surgical nurse, you get day-to-day direct patient interaction with patients of all ages from all backgrounds. And now we move on to the critical care nurses. A critical care nurse works with critically ill patients, typically in the intensive care unit, or what we call ICU, but here in the UK we call it ITU, intensive care unit. A critically ill patient refers to someone with a life-threatening problem. These nurses work with their patients and act as an advocate for them. And I clearly remember that I worked as an on-call reliever back in Mother Seton for a few months, and most of the time they needed a nurse in the ITU or ICU. So I initially planned to be a critical care nurse, but things changed again. But my recent experience for critical care areas is during the 2020 pandemic. So I was an agency nurse and I was placed in ICU. And when I went to my new trust, I was redeployed for 3 months in ICU. But I had to do a basic ICU course before I can go in there, because they're really short and the number of ventilated patients keeps on growing because of the COVID situation. But anyway, this is one of the nursing fields where the nursing shortage has hit the hardest, so critical care nurses are in high demand. Okay, so we now move on to the post-anesthesia care nursing. So a post-anesthesia care nurse works in a post-anesthesia care unit, or sometimes what we call PACU, where patients recover from a previously administered anesthesia. They help ensure that the patient wakes up without complications and are responsible for things such as airway management, life support operations, pain management, draining catheters, and managing wounds from surgery. So I remember my recent experience from recovering patient is normally in my current post right now. Because in the cath lab, sometimes we do procedures wherein we had to liaise with the anesthetic team. For instance, if we had to do cryoablations or EF ablation, or let's say a patient has dementia and needs to be tubed, we need to work with the anesthetic team, and after that, us nurses would recover these patients. And normally, my approach is the ABCDE approach or principle, wherein I normally tend to look into their airway, breathing, circulation, disability, and exposure. So I hope that helps if one day you recover a patient. Now we move on to the NICU or the PICO nursing, wherein we've got the neonatal intensive care unit or the pediatric intensive care unit. Both of these units are used to care for critically ill children. The difference is that in NICU, we deal with newborns, that means the first 28 days of life. Whereas PICO, we are dealing with infants, children up to the age of 17. If you enjoy working and caring for ill children, this may be a good career path for you. And now we move on to oncology nursing. An oncology nurse works with cancer patients and provides all of the necessary day-to-day care. An oncology nurse educates patients and the families, consults both doctor and the patients, and coordinate the treatment. A basic BSN degree is okay with an oncology nurse. That is all needed for this field. And there are many different specialties a nurse can have with oncology, many of which may require or at least encourage an advanced certification. Some of the specialties include chemotherapy, breast oncology, radiation, gynae oncology, palliative care, and early detection and prevention. Next up is the neuroscience nurse. A neuroscience nurse, sometimes called a neuronurse for short, deals with conditions that involves the nervous system, the system that we all know our whole body uses to function. These nurses typically deal with patients who suffer from neurological problems such as trauma to the spine or injury to the spine. Some of the diseases that cause injury to the spine includes Parkinson's disease, encephalitis, epilepsy, and multiple sclerosis. A neuronurse provides daily care, rehabilitation care, treatment plans, education, and so much more for these patients. Labor and delivery nurse. A labor and delivery nurse is responsible for bringing life into the world on a daily basis. They coach mothers through the birthing process during active labor and prepare the new parents to take their child home. This can include educating new parents on topics such as breastfeeding, holding and swaddling a baby, and so much more. Labor and delivery nurse is also responsible for monitoring the health of the new baby. This is a fast-paced, client-facing area, but many who choose the field love it very much. Pain management nurse. A pain management nurse works with patients to alleviate pain, both acute and chronic pain. They work with patients to identify the pain and work with doctors to come up with a treatment plan. There are advanced certifications for this position, and one is not always required to obtain a position as a pain management nurse. A rheumatology nurse. A rheumatology nurse works with patients that have a rheumatology disease. This disease is caused by inflammation of the joints or muscles. These diseases include lupus, rheumatoid arthritis, myositis, spondylitis, Lyme disease, and fibromyalgia. These nurses deal a lot with blood analysis, education of patients, and pain management. The nursing jobs I mentioned are by no means a comprehensive list. There are other roles that you can be in a hospital. You can join the navigation team. You can be a research nurse, an outreach nurse, a bed manager. As a summary of this talk, I have established that working in the hospital is one of the familiar ways of doing nursing, and a newly grad can easily go into the hospital route, so that you can all have the basic nursing skills in the hospital, and you have got options where you want to grow in. There will be days wherein you'll feel that you don't want to be a nurse, or but there are also days that you feel very appreciated by your patients or by your colleagues. So there are peaks and valleys in the life of a nurse, and it is really good that you've got a good foundation. You're lucky that you are in USI, because I firmly believe that all your teachers, your clinical instructors, are helping you build the right foundation in order to face the real. And I know that there are shortages in nurses and discrepancies when it comes to salaries, but I am hopeful that this can be sorted eventually. That's the end of the talk. I hope you enjoyed it. I hope I didn't bore you. But if you want to interact or ask questions, I can put my social media handles on the screen, and you can say hi or ask a question. Thank you and God bless.